Ethiopia, a nation of vibrant culture and ancient history, stands on the precipice of a devastating healthcare crisis. In a matter of days, the nation's hospitals and clinics could fall silent. Ethiopian healthcare workers, the very backbone of the nation's health system, have vowed to cease work. Unless their demands for better pay and improved working conditions are met, only emergency services will remain. This looming strike threatens to plunge the nation into a healthcare emergency of unprecedented proportions. This crisis has been brewing for years. Healthcare workers, struggling to survive on meager wages, have repeatedly voiced their concerns. They describe their current pay as unlivable, forcing them to choose between basic necessities and their own well-being. The Ethiopian Healthcare Professionals Association, EHPA, representing these desperate workers, has been tirelessly advocating for change. They have presented their demands, pleading for a lifeline from a government that seems unwilling or unable to act. The average monthly salary for a healthcare worker in Ethiopia hovers around a meager 12,000 to 13,000 birr, equivalent to a paltry $90 to $100 USD. These individuals entrusted with the health and well-being of millions are barely able to afford basic necessities for themselves and their families. They live in a constant state of financial insecurity, their plight a stark contrast to the crucial role they play in society. The abysmal working conditions further exacerbate their plight. Overcrowded hospitals, a shortage of essential medical supplies, and long, grueling hours have become the norm. Driven by a deep sense of duty, these healthcare professionals persevere, but the strain is palpable. They are burning out, their physical and mental health stretched to the breaking point. The Ethiopian government's response to this growing crisis has been met with disappointment and frustration. While acknowledging the plight of healthcare workers, their proposed solutions have fallen far short of expectations. Vague promises of short, medium, and long-term plans, including non-salary incentives, have done little to quell the rising tide of anger and despair. The arrest of EHPA President Yonatan Dagnall on May 11, 2025, sent shockwaves through the medical community. His detention, along with reports of other healthcare workers being targeted, has cast a long shadow over the government's commitment to dialogue and resolution. The government's actions have been perceived as heavy-handed and dismissive, further eroding trust and fueling the flames of discontent. The potential consequences of a full-blown healthcare strike in Ethiopia are nothing short of catastrophic. Millions of Ethiopians, already grappling with limited access to healthcare, could face unimaginable suffering. Hospitals, already stretched to their limits, would be forced to turn away all but the most critical patients. Routine medical care, from vaccinations to chronic disease management, would grind to a halt. The human cost of this impending crisis is immeasurable. Lives hang in the balance as the clock ticks down to a standstill. The Ethiopian government must act decisively and compassionately to avert this looming disaster. The health and well-being of an entire nation depend on it.